name is Kaylee Heffernan, and I'm going to be showing you the structures and my dissection of a sheep's heart. So to start, we have the aorta, which is a large artery that emerges from the left ventricle carrying blood into the systemic circuit. We then have the apex, which is this pointed end of the heart consisting of muscle, and it's from the left ventricle. We then have the artery, which is here at the top. We have lots of arteries that are carrying blood away from the heart. Then we have the auricle, which is an ear-like flap of muscle, which is made directly from the atria. We then have the base, which is a point of attachment for the blood vessels entering and exiting the heart. It's here at the top of the heart. Then looking at the bicuspid valve, it separates the left atrium and ventricle, and it's sometimes called the mitral valve. We then have the brachiocephalic trunk, which is here at the top of the heart, and it is a branch of the aorta that splits to form the right subclavian artery and the right common carotid artery. So looking for the chordae tendineae, this is one of the easiest structures to identify. It is here, this like string-like material here, and it connects the bicuspid and tricuspid valves to the papillary muscles. So we have the coronary artery, which is an artery leading from the aorta that supplies blood to the heart and muscle. We then have the inferior vena cava, which if we flip to the back view of the heart, it is right here, which is a large vein that returns blood from the lower body regions to the right atrium. The intraventricular septum is this very large muscular wall between, it separates the right and left ventricles. Okay, so for the papillary muscles, they are right here, and they are muscles anchoring the chordae tendineae into the valves. Looking for the semilunar valve, it is right here on the left side of the heart, and it is a valve between the aorta and the left ventricle and between the pulmonary trunk and right ventricle. For the superior vena cava, you look kind of here at the back, it's right here, and it is a large vein that returns blood from the upper regions of the body to the right atrium to be reoxygenated. The trabecular carne is right here, and it is ridges and folds of the walls of the walls of the ventricle. We then have the tricuspid valve, which is right here on the left side of the heart, which separates the right atrium and the right ventricle. We have the vein, which if we look at the back of the heart again, are right here, and they are blood vessels that will return blood to the heart. Now looking lastly for the ventricles, we kind of already spoke about them, but they are at the base of they're at the apex of the heart, and they have right here, this is the left ventricle, and then over here we have the right ventricle, and they force blood into either the aorta or into the pulmonary arteries.